Imagine feeling unwell and your concerns are dismissed. Now, imagine another situation where you exactly know what to say and how to get the care you deserve. This is why self-advocacy is very important in healthcare matters. I'm Dr. Joshua Derito, a family physician. I have interest in cancer prevention and treatment and public health. In this video, we are going to talk about advocating for your health in the healthcare system. So, why advocating for your health is important? One, it ensures that you receive the proper diagnosis and treatment. Two, it helps to prevent medical errors. Then it helps to improve communication with the healthcare providers. When you present your problems succinctly and candidly, it helps the healthcare provider understand what is your problem, and this helps the communication. Then it empowers you to make informed decisions. When you know what is your problem, when you have been told what are the findings after your examination, what are the results of your test, then it makes it easier for you to make a decision. Then how do you go about to advocate for your health? One, it is always good to be prepared. How do you prepare for yourself when you are going for a doctor's visit? It is important that you write the things that are bothering you down. You can write them in a paper, you can write them in an app, or you can write them in a portal that you can be able to refer to. And also write questions that you might be having that you may want to be asking the doctor or the healthcare provider. And then if you have any previous history, any previous records, then it is important that you carry that information. And if you have drugs, because sometimes it becomes very difficult, you want to tell the doctor drugs that you are taking, but you cannot remember their names. So both of you are at a loss on what you are taking, and this does not help in your management. Then speak clearly and confidently. Remember that the doctor is not your boss. He's your colleague. You are talking to help each other to improve your health, and so have the confidence to say what is bothering you and the concerns that you have. Then for anything that you don't understand, it is always important that you ask for explanations. The doctor will be willing to explain to you what is happening. Then when you are going for the consultation, if it is possible, have a friend or trusted family members whom you can share your concerns and who can also give you the confidence that you need and the company when you feel unsure of what is happening, and can also remind you of some of the things that have been happening to you and you may want to talk to the doctor about. Then research your condition and the treatment options. It is always good to refer back, but of course when you are researching, remember to look for information in trusted journals and in trusted medical sites like the Kenya Medical Research Institute website, the hospital websites that are hospitals of recognition that are properly registered, they will give you, and even medical sites that are well researched and well trusted, so that you know that whatever information you are getting is authentic. Then know the patient's right. In most of the institutions that you go, you will find a charter that outlines the patient's rights, and you should always be conversant with them. So how do you communicate effectively? One, it is important to be honest and specific about the symptoms. It is always good to tell the doctor what is bothering you, how do you feel. If you have pain, tell him, I have a pain here, it starts here, it goes where, and then always tell the doctor what you are feeling, not what you have been told about. Sometimes a patient will come to you and tell you, I have been told I have ulcers, or I have been told that I have typhoid, or I have brucella. Then it makes it very difficult, or sometimes it misleads the doctor on what would be your diagnosis. Unless you have conditions like hypertension, you have diabetes, which you are taking medicines. Otherwise, if there's a different problem that has started, it is always good to check what are the symptoms that you have, what is making them better, what is making them worse. It helps the doctor to make unbiased diagnosis about your problem. Then use simple and clear language. Avoid terms that you don't understand. Sometimes you have heard of some medical jargon which might not help your situation. It only makes it very difficult. Then take notes during the appointment. If there is something that you have been told, it is always good to note what you have been told, and then you can refer to it at a later date. Then repeat back what you understand. I always try as much as possible to go through with the patient what are the main things, what we have found out, what is the way forward, and what the patient should undertake. Is it some test? Is it some dietary changes? And you discuss what is possible and what is not possible, so that you leave the doctor's consultation knowing what is the way forward. And then do not be afraid of asking for a second opinion. If you feel that what you have been told, you have issues with it, or there's something that you need some clarification, it's always good to seek for a second opinion. And also you can also ask your health provider if he can refer you to another person whom you would want to get a second opinion. Doctors are always ready and willing to give you another colleague who can give you a second opinion about your condition. So how do you overcome the barriers to advocating for your health? One is fear of questioning authority. The doctor, as I said, yes, he knows much about medicine, he knows much about the health medical practice, but he's not your boss. So always ask what concerns you, what you're not satisfied about, and what you need more explanation. Then try to research as much as possible. Having no knowledge of medical knowledge sometimes makes you feel intimidated, and it makes you want to believe everything that the doctor tells you. Then you also have cultural and language barriers, which can be an impediment to you advocating for your health. Then time constraints in medical visit. You have a doctor who has a long line. Sometimes as a patient, you are feeling for the other patient. But remember, when you are in the doctor's room, you are the only patient that the doctor is concerned about. So don't worry about all the other things. But of course, try to maintain your discussions within the medical problem that you have. Sometimes you may want to discuss other things outside the consultation, as that would take time for the other patient. But if it is what concerns you, then please ask any question that is relevant to your consultation. Then stay informed, be assertive about what you want, and also seek support from your health provider. So some of the things that we may need to advocate is situations that require for special attention. Like if you have someone admitted in hospital, you need to know what they are doing, what is their problem. Then of course, remember that for you to get the information about your patient, then it has to be within the confidentiality bounds of the doctor. And it is always good to know and find out what the doctor can be able to reveal to you as an advocate to your patient. Then navigating insurance and billing issues. These can be the only issues, but you need to know about them. Then dealing with misdiagnosis or medical errors. These can be very frustrating situations, and then sometimes you may not know what to do. And then finding the right specialist and the care options. You need to get informed. So how do you take care and control of your health? Voice your most powerful tool in healthcare, and that is speaking up, staying informed, and also never settle for less than what you deserve. Remember that your health is your right, and you have to be taken care of, and you have to be taken as a partner in your healthcare. So for more hacks on how to navigate the healthcare system, remember to subscribe to the Overall Health channel, and also to ring the bell on the screen, so that when we release new content, you can always be alerted. And also remember to visit the Wellness Health Services website. You can get more content on what services we offer. And also, if you have questions, you can always send them there, or you can make your comments on the comment section below this video. Thank you.